Hello, beautiful people. Welcome back again. It's your favorite nurse. My name is Suliet. Today, we'll be discussing cardiac arrest and cardiopulmonary resuscitation, also known as CPR. Cardiac arrest occurs when the heart suddenly stops pumping blood to other parts of the body. Some people mistake cardiac arrest for heart attack. They are different. Heart attack is when there's disruption of blood to some part of the heart. That's like a blockage in one of the arteries. So heart attack can cause cardiac arrest, but cardiac arrest can't cause heart attack. And when you've got heart attack, you're most likely going to be conscious. But in cardiac arrest, the individual is unconscious, is unresponsive, is not breathing, and if they are breathing, it is going to be a gasp breathing. So when you find someone suddenly slump, they are unconscious, they are unresponsive, what do we do? And the intervention which we do is what we call CPR, or cardiopulmonary resuscitation, which is a first aid care given to someone with cardiac arrest. And everyone is obliged with that responsibility to know how to perform a CPR, even though it might not be effective, because every minute, every seconds counts when someone have cardiac arrest, and that intervention you give at that time is very crucial. It plays a vital role. So how do we perform CPR? When you see a person slump, you have to approach, and when you approach, your safety matters first. Check around, is the place safe to proceed? If it's safe to proceed, you proceed. You tap on the individual and ask if the person is all right. If there is no response from the person, check the chest. Is it rising and falling? That's a sign if the person is breathing or not. You can bring your face closer to the person's nose. Check if the person, if you can see air going in and out. If not, you have to quickly call for emergency. The emergency number in the United Kingdom is 999, and the one for Nigeria is 112. We need to be familiar with our local emergency number in such cases. So having done that, you have to, if it's possible, to open the person's shirt, or however, if it's not, you have to move to action quickly. You put your hand, you use the heel of your palm, you put it in between the person's chest, that's the breast line. You put one hand on the other, and you begin to compress. Try to make your shoulders straight, and also your arms straight. You compress as deep as you can, and you should try to, if you can, you have to achieve 100 to 120 compressions in 1 minute. You have to continue this until emergency comes, and then you allow the emergency team or the medical team to take over. This action helps the heart pump blood to the other parts of the body, and it can save life, as I've said. And also, it can also prevent permanent brain damage, which can occur when there is no blood supply to the brain. So I hope today we've learned something